The fetal heart tube fuses and merges by day 20 and is derived from the lateral mesoderm germ layer. This forms the primitive heart tube, which is divided into 5 sections. The truncus arteriosus is the most cephalad portion and will form the aorta and pulmonary artery trunks. The bulbus cordus is divided into 3 sections: the primitive right ventricle, the ventricular outflow tracts, and the truncus arteriosus. The ventricle section is the primitive ventricle and will become the morphologic left ventricle, which will eventually be divided by the interventricular septum. The atria portion will become the left atrium and right atrium and will be divided by the interatrial septum. The sinus venosus consists of a right and a left horn and will lead to the formation of the SVC, IVC, coronary sinus, and the posterior wall of the atrium, otherwise known as the sinus venerum. The right horn will become the posterior wall of the atrium and the eustachian and thebesian valve, and the proximal portion of the left horn will become the coronary sinus, while the distal left horn will disappear. The heart loops during week 3 and is completely formed by week 7. Normal looping of the heart tube occurs anterior, inferior, and to the right. During looping, it is important to note that the primitive atria and sinus venosus of the heart tube move superior and posterior. The heart begins to pulsate via peristaltic waves by day 21. The peristaltic waves move the blood through the primitive heart tube and is considered the beginning of circulation. 3 paired veins drain into the primitive heart tube through the sinus venosus. These are the vitelline veins, the umbilical veins, and the common cardinal veins. The vitelline veins return poorly oxygenated blood from the yolk sac. More specifically, the right vitelline veins become the hepatic veins and portal veins, and the left vitelline veins regress. The umbilical veins bring oxygenated blood from the placenta via a shunt called the ductus venosus, which is located between the liver and the umbilical vein. The common cardinal veins return poorly oxygenated blood from the embryo body to the heart. When discussing circulation through the heart tube, it is important to note that there is unidirectional blood flow that occurs through the tube traveling caudad to cephalad, or venous to arterial. Blood will enter the sinus venosus, and from the sinus venosus it will enter the primordial atrium. It then passes through the AV canal into the primordial ventricle. When the ventricle contracts, blood is then being pumped through the bulbus cordus and the truncus arteriosus into the aortic sac. It is then distributed to the pharyngeal arch arteries.